Hello, Vermont, and a special welcome to our Vermont Pathways to Partners statewide partners who are collaborating on this exciting and innovative project for the state of Vermont. I am Dr. Jacqueline Kelleher. I'm the Executive Director of Vermont Family Network. I'd like to tell you a little bit about our organization and then describe some of the um, products and services and trainings and things that we're going to have the privilege to be able to do as part of this federal investment. Vermont Family Network, we've been helping Vermont families thrive for more than 30 years. The mission of our network is to empower and support all Vermont children, youth, and families, especially those with disabilities or complex special health needs. We do this in three ways that I can categorize. One is by giving a strong start. We're supporting families before, during, and after a diagnosis or an eligibility determination arises. When you get that diagnosis or that IEP and you don't know where to start, we are either the virtual or physical arms you can fall into, and we help you chart that journey for yourselves and for your kids, and how to work with everything from your school districts to how to navigate the complexities of Medicaid or insurance and paperwork. And so we serve families raising kids from infants up through age 26. And even with that said, we have many calls all the time as kids are going beyond age 6 about what do we do from here? You know, where do we start in this new phase of our child's journey? The second area that we are promoting is lifting family voices. We're empowering families to become the best advocates for their kids on an individual level, a state level, and at a national level. And then briefly, the third, element that's part of our mission is advancing inclusive communities. We're partnering with families and schools and service agencies and communities to create environments where all children and youth can thrive. Our team is primarily parents of children and youth with disabilities and special health needs. So it's really amazing to be with like 90% of our organization, to be with colleagues who have that lived experience, and they get it, they know it. So not only are they have the professional qualities and are knowledgeable about the resources and rights and responsibilities, but they truly get it and understand how to help you navigate through all of the systems in the area of education, mental health, and healthcare. I also have to mention we have a powerful arts engagement program through our Puppets in Education. Our puppets travel through Vermont schools, visiting students and faculty preschool up to 8th grade, working on some important social emotional learning topics. Some of our most requested puppet performances just this year have been around kindness, stress, anxiety, bullying, and we also do disability specific performances. Each school is left with a curriculum guide and facilitated questions to continue the learning after the performance. And the kids can always be engaged with our puppets because the puppets have their own email system. And sometimes we find that our kids are more likely to want to reach out to a puppet than maybe other people when they have things on their mind. So we have a lot of engagement. Many of you know our work in the area of transition. Our staff, and we have, I think the longevity for VFN is incredible. Our staff have been there from 6 to 20 plus years. And transition has been, part of the heart and soul of where we help families through our helpline or through our fact sheets, through our trainings. So any of that information, you can reach out to our website, www.vermontfamilynetwork.org, or you can shoot us an email at info@vtfn.org. Come learn about all we have to offer at no cost. We're your federally designated Parent Training Information Center and Family to Family Health Center. So, we're as dedicated to supporting school-based personnel and service agencies and providers as much as we are our families. Some of the exciting things that I really mean that we have the privilege, a true privilege to do with part of this grant project, comes in like three different buckets. One is we're able to offer some type of administrative support. So for example, in three areas, communication and outreach services. I won't give an exhaustive list at this point, but for example, recruitment, including hard to reach populations, being able to maintain a dedicated web page, which is required by this grant, being able to connect with translators and cultural brokers, ensuring all messages are being maximized that include an emphasis on diversity, equity, and inclusion, engaging us with partners from social justice organizations. Our communications will also be part of the community conversations that we have statewide. So in addition to communication and outreach, we will be helping to support the website development, a shared resource library that we all can benefit from. That's truly exciting. We also have for our finance office services, will be able to help to ensure payments of stipends and project activity expenditure, monitoring and tracking of the budget, and various things where it can be difficult in some of our organizations to flow through fiscal support to various grant activities, and that's something we'll be able to help out with. And then some logistics and coordination. That's another service. It's something that we already do, that we'll be working with the Dale team to find out the best way to be able to support meetings and to maintain minutes, coordinate schedules, being able to arrange for interpreters and cultural brokers, registering participants in training, sending certificates of completion, and on and on. So that's one arm of the workflow that we're excited to support. We also, as part of our mission, offering trainings and workshops and consultations over the next 5 years. We've talked about some suggested topics, but this is something that the state partners can help guide. So just a few examples would be family engagement consultations with districts and service agency, fact sheets on family engagement impact and best practices with respect to indicator 13 and 14 and summary of performance, high expectation, parent training on transition planning and their role in extending the learning and resources into their home. We're qualified to do IEP team training for IEP teams, training for school-based professionals and youth service professionals, in all of the different transition related topics that as appropriate. We're also looking forward to working with the Agency of Ed on the indicator 14, which is the 1 year post graduation or exit, with enhancing that data collection so we can improve our response rates and make sure we're getting access to the students through the families. We really want to improve those response rates, since that's a critical data point that's going to help ground so much of what we do this year. And then finally, the other bucket is that we're excited to be working on some innovative practices. I mentioned the community conversations that we want to have statewide, which are a turned outward way to authentically engage members of the community, that generate public knowledge that can be used to inform decision-making of all kinds. And these themes are also going to help guide the state partners and the leaders on this project about where do we aspire to be as a state and how do we get there over the 5 years. And often these conversations lead to important understanding of what resources are available. We're going to be involved in the local resource mapping, where we can, by either county or region, have some quantitative information, the profile of those communities, with specific variables that are related to supporting transition-aged youth, as well as what services and supports are available. That will be updated each year that we can use to guide the conversation about not only how are we doing, but looking at equity across our state. Where are we heavy in some resources, light in others, or what innovative practice exists in some places that may not be reaching other parts of the state? So that mapping is another really important project. And we are also, with our creative passions that I've expressed too, we're going to be working with filmmakers with disabilities, have a little mini internship program where we are doing some short animated films to engage our youth, inform them of their rights, inform them about self-advocacy, inform them about how critical that their input is on their IEP and in their transition plans. So we will be doing some novel new short films that will help us even reach further all the people that need to be involved in this really important project. So that's not even the whole list, just a comprehensive overview. And again, we are just thrilled to work with everybody and are nimble and flexible, and will pivot to where this project goes in terms of the resources that we have and the skill set that we provide to make this truly a value-added partnership and sustainable, improved outcomes for all of our transitioned aged youth and their futures post-secondary. Thank you.